Namaskar, everybody. Um, Good morning to all our viewers in United States, and good evening to everybody here in India. We welcome you once again to our webinar here on YouTube and Facebook, being broadcasted live on both our YouTube and Facebook channel. For our repeated viewers who have always been coming to our webinars and watching our webinars, welcome once again. You have already been introduced to American Academy, but for our new viewers who are joining us for the first time, I take this opportunity to introduce the American Academy of Yoga and Meditation before we start our webinar for today, which is based on migraine, understanding a holistic management of the condition of migraine. So, American Academy of Yoga and Meditation is a not-for-profit organization based out of Memphis, USA. The activities of the academy are dedicated in the field of research and learning and education of yoga and meditation. The purpose of this is complete wellness of each and every individual and the entire mankind. The Ganges Mississippi Dialogue is also one of our initiative through which we invite the best scientists, physicians, yoga practitioners from all across the world to contribute to this knowledge source and bring forward some research-based yogic practice or integrative wellness practices in form of dialogue and webinars. So today's webinar is based on the subject of migraine. As our promotional message says, that migraine is one of the most common illness faced all across the world. In fact, more than 1 billion people suffer from this condition. And all of us have a lot of questions regarding headache and migraine, because that is a condition which really affects our life, the quality of life, and our day-to-day life. So speaking to us today, we have wonderful speakers with us, and the session for today's webinar is being moderated by Dr. Manjunath. A small introduction of Dr. Manjunath. Dr. Manjunath is Director of Research and International Affairs at S. Vyasa University. He has a bachelor's degree in naturopathy and yogic sciences, and has done his PhD in yoga and geriatric medicine and has Doctor of Science from S. Vyasa University. He has 25 years of research experience and has published 67 research papers in journals indexed in international bibliographical databases. His research interests include psychophysiology of yoga, neural correlates of meditation, aging, and rehabilitation. He believes in integrative medicine as the future of healthcare and conducting several studies combining the best of Ayush system with conventional medicine. He has guided several students of PhD and MSc. Dr. Manjunath has delivered lectures on evidence-based yoga therapy and conducted workshops at prestigious institutes and universities across the world. He is the editor of International Journal of Yoga, iJoy, and reviewer of various international journals. He serves as member of Scientific Advisory Committee, Department of Science and Technology, Satyam Project, and Research Committee, Integrative Medicine, Niti Aayog, Working Committee Program Accreditation, NAAC, Government of India. He is also Vice President of Vivekananda Yoga University, California, USA, Director, Boston Center of Excellence, Boston, USA, Vice President of Asian Yoga Therapy Association, Singapore. I now welcome Dr. Manjunath to please conduct this webinar. Namaskar, Dr. Manjunath, and welcome to this webinar conducted by American Academy of Yoga and Meditation. Over to you, sir.
Thank you. Thank you very much, Dr. Anjali, for that wonderful introduction. And this topic particularly, which we have taken up for discussion today, is something which many people have probably gone through as an issue. Many people have attempted treating as physicians. And we keep hearing uh, as part of pain management as one of the mainstream which people would like to attempt to focus on. But today, to talk about this one condition, which is mm, one of the big brothers of pain management issues, which is migraine. So, to discuss, we have three the most eminent personalities, speakers today. They will also be giving brief views about migraine and focusing on to various systems of medicine. Dr. Praveen Thomas, Dr. Vasudha M. Sharma, and Dr. Geeta Shetty. So all three speakers, Dr. Praveen Thomas representing conventional medicine, and Dr. Vasudha representing Indian systems of medicine, particularly coming from Ayurveda and Yoga. And we have Dr. Geeta Shetty coming from the discipline of naturopathy and yogic sciences with a specialty into acupuncture. So it's my privilege introducing the three panelists and speakers for today. So let me start introducing Dr. Vasudha M. Sharma as Dr. Praveen Thomas, who is joining us from UK, will be with us in a few minutes. And meanwhile, let me take the privilege of introducing Dr. Vasudha M. Sharma to all of you. So, Dr. Vasudha M. Sharma is the Director of Medical Services of Vivekananda Health Global, an international chain of integrative medicine based centers headquartered at Bengaluru. VHG, also in brief, which is Vivekananda Health Global, is a brand of Vyasa Healthcare Private Limited, and it integrates Ayurveda, Yoga, naturopathy, and various other systems of medicine for better treatment outcomes. She is an entrepreneur in the field of integrative medicine, an Ayurveda and yoga therapy consultant, researcher, and international speaker with 20 years of clinical experience. She has completed a bachelor's degree in Ayurveda from the Government Ayurveda Medical College in Bengaluru in the year 1999 and master's and PhD in yoga from Vyasa University. Her doctoral work is on integrating Ayurveda and yoga therapy in the management of migraine headache without aura. She has published 4 research papers exclusively from this doctoral work based on her research into migraine. She has been a clinical practitioner for over 20 years and practicing integrative medicine since 15 years, combining traditional Indian systems of medicine along with conventional medicine. Her area of specialization includes integrative pain management with a focus on migraine headache and women health problems, including infertility. She is also an adjunct faculty at the Division of Yoga and Life Sciences at Vyasa University, Bengaluru, and an external examiner for a couple of universities for doctoral and PG students. She has been a speaker at several international conferences and conducted workshops across the world. And the very important one recently is her presentation on the intervention of yoga and Ayurveda in the management of migraine headache at the American Headache Society's annual Congress. She is presently the director of holistic section of the World Headache Society. She is also the reviewer of several journals, including the Journal of Ayurveda and Integrative Medicine. So it's my privilege welcoming Dr. Vasudha Sharma. And for today's whole discussion, we have kept an initial presentation by each speaker for, let's say, around 10 minutes, followed by a brief discussion, and we will take up good number of questions from all of you. So over to Dr. Vasudha to make a brief presentation about her perspectives, bringing ancient Indian wisdom of understanding and managing migraine headache. Dr. Vasudha M. Sharma, please.
Thank you very much, Dr. Manjunath, for the introduction. Namaste, everyone. And thanks, AAYM, for having invited. So I'm glad to be here and to put forward my presentation and my experience in the field of management of migraine headache, especially using Ayurveda and yoga. May I request the presentation to be shared, please? So when we talk about migraine, what first comes into the head is such a bad pain. And what do I do? Many of them, they just say, I've got a bad migraine and let me just go sleep off. Don't wake me up. And when I'm all right, let me come back, and come back and stay along. Otherwise, you might have episodes of nausea, you might have episodes of vomiting. You may pop a pill, you may not pop a pill. So it is all personality driven, and also the pain and agony you undergo when you have a problem like migraine headache. So this is what we do when we get a headache. So what all does it impact? How all does migraine influence? It influences a person at his personal level, at his social level. It causes so much of burden, not only on a person as an individual, but also at the familial level. There is large psychological impact with great social consequences because it is impacting the physical aspects and his physical health at a very regular interval. What also happens here is, when I say at the personal level, when any individual has a migraine, he has an incapacitation to do his work. Now if I have to go to work, if I have a mild to moderate condition of migraine, I'm still able to work. But if I have anything beyond a moderate, and if it moves towards a severe condition of migraine, then I may have to take off from work. So, what do people do? So, many times they have great absentia from work. This is where there is so much of burden on an individual. If not, he might have to take medication, he might have to be on prophylactic medicines. So, this is how a person has to manage. Therefore, the influence on the occupation, academics, social life, leisure life, so it has large influence on all these aspects. Next slide, please. So when we understand how do we handle this with you, especially using Ayurveda and yoga, I am not getting into the details of how migraine occurs, what happens, and why, and so on and so forth, because Dr. Praveen is there. He will elaborate more on this. So I'm coming on to understanding how Ayurveda and yoga would help us. What we need to primarily understand is Ayurveda and yoga are independent systems of medicine, and they offer specific treatment when it comes to them independently. But still, we are looking at integration, and that has been my experience. I have also had an experience where I have used only Ayurveda, and I have also had an experience where I have used Ayurveda with yoga, and it was very clear that integration is the key. Why? Because we understand further as the presentation goes on. So, integrating these two systems would basically enhance the benefits which an individual would have, because the focus is just not on the physical body but on the mental well being. So, you have relaxation responses much beyond this level. Therefore, the mind body soul complex also plays a crucial role. So, otherwise, Ayurveda yoga, especially in India, is very congruent to beliefs of the people and very close to their health and lifestyle, because this is also imbibed as a culture in them. Now, further, just briefly understanding what Ayurveda talks about. Ayurveda is an ancient system of Indian, origin, which is basically talking about concepts of tridoshas, which are like three pillars. A tripod has got three, these stands. Similarly, are the three aspects, which are the vata, pitta, and kapha. So when I say this, I think everybody understands these terminologies, and this is the base of Ayurveda, and these are called the doshas. Then come the dhatus. So when we say dhatus, these are the elements, the tissues which the body is made up of, and Ayurveda classifies seven dhatus. Mala, these are the excretory elements, and Ayurveda talks about three malas. Then come the other components such as Atma, the soul, the Indriyas, which are the sense organs, and the Manas, which is your mind. So here is the key, the mind-body approach of Ayurveda. So based on the doshas, the Prakriti is defined, or the body constitution of an individual is designated. And based on this, people are recommended various ahara, which are the diet regimen, vihara, which is lifestyle regimen, and based on this, once again, the treatment line is designated. So broad classification of the treatment line in Ayurveda are Shodhana and Shamana, which are the cleansing mechanisms or the biopurificatory mechanisms or techniques, which are the Panchakarma, very, very well known. Panchakarma, which are the 5 treatment methodologies, which include Vamana, which is induced vomiting, Virechana, induced purgation, Basti, which is a rectal route of administering medication, easy to understand, a form of enema. And then you have Nasya, which is nasal installation of medication. And then you have Rakta Mokshana, which is a different type of bloodletting therapies. So Shamana refers to pacificatory line of treatment, which is medication based mainly. And when we go further, let's also briefly understand what yoga talks about. So yoga largely talks about harmonizing my body and mind and talks about the Panchakosha concept. So it defines the body into 5 layers when you talk about the Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, and Anandamaya Kosha. So Anandamaya Kosha is the final sheath of bliss. And yoga also elaborates on Triguna. So the Trigunas are Sattva, Rajas, and Tamas. So when we talk about the Trigunas, the aspects of these are transformed into the body, and once again, the ahara, which is the diet, lifestyle, etc., can be designated. Next slide, please. So why have I given this brief is because we now understand how both of them have been integrated and how study has been conducted elaborately to understand. So this particular scientific study was conducted, by myself and the team which has supported me in doing this. And we have studied about 30 individuals, and their intervention was basically measured at day 1, day 30, and day 90. So before we started off the intervention, we assessed them with the following, which are MIDAS, Migraine Disability Assessment Score. We used a perceived stress scale. We also used another questionnaire called Comprehensive Headache-Related Quality of Life Questionnaire. We had a symptom checklist. We also measured their heart rate variability and surface electromyography. Next slide, please. So based on this, what did we intervene with? We intervened with the standard Ayurveda Panchakarma methodology of Virechana, which is the induced purgation, and which is highly recommended for a condition like migraine because it is said to be a Pitta dominant disorder. And when you have Pitta dominance, Virechana is one of the indicated measures as per Ayurveda. So I selected Virechana, and once Virechana was, conducted upon different individuals, followed by that was yoga therapy. So we made people learn the complete yoga therapy module for a minimum period of 7 days, and it was very individualized. So there was a doctor that I used to teach every individual in this particular group where they learned it and then they followed up at home, and we always did their follow-up. Followed by this was also oral medication, and oral medication was restricted to very specific herbal concoctions and minimalistic herbs being used in the same. Can we go over? So just to take you across, these were the changes we found after the intervention. So these were the symptoms which were also measured: 5 or more migraine attacks in individuals, and the maximum duration of attacks were found to have been reduced after the 90 days of intervention. Similarly, we also found changes with the other symptoms. Next slide, please. That is the severity of headache, nausea and vomiting, analgesic requirement, and so on and so. Analgesic requirement is something where we can draw our attention. So here in this study, we specifically did not use any prophylaxis, but we only had them on analgesics only when required. So it was on an SOS basis, and before this, they were evaluated by a neurologist. So we very clearly have seen that people who are on large analgesics, their dosages or the requirement of the analgesic did come down very significantly. Next slide. So what is the basis behind this intervention? So I have just, briefed you on the symptom checklist, but we found very significant results when we measured the heart rate variability and also the surface electromyography. So heart rate variability very clearly showed that the sympathetic dominance had reduced and there was a better sympathovagal balance post-intervention. So what was the basis of our intervention? Migraine, as per Ayurveda, is called Ardhava Bhedaka, and it is said to be having predominant pitta-based signs and symptoms. And oxidative stress is said to be present, in or seen in patients with migraine. And we also see that there is upregulation of genes related to the oxidative stress pathway in pitta individuals. And when we give Virechana, this is what happened. So when we saw the reduction, therefore, the change. And we also use certain herbs like Triphala, neem, turmeric, guduchi, that is Tinospora, and Andrographis paniculata. Next slide, please. So these are the next slide also gives us some pictures of these same herbs. Triphala has the Terminalia chebula, Terminalia bellerica, and Ambelica officinalis. So amla is very well seen in Indian gardens. And then we have Andrographis, curcuma, Azadiricta, which is neem, and Tinospora, which is guduchi. Next slide, please. So here, using these herbal concoctions and also integrating them with yoga, we found that the pain intensity, frequency, the pain rating index, for which yoga has always been known for, was used as one of the reasons for integrating yoga into this. Yoga has also shown very good autonomic modulation. That's because yoga helps in bringing better sympathovagal balance. Previous RCTs have also showed how certain meditation techniques have brought down reduction in migraine headaches based on the intervention they have used, such as Midas and HIT6. Next slide, please. So the overall, the proposed mechanisms we would say are based on how this intervention helped is by the use of Ayurveda, pitta and oxidative stress and reduced. By the use of the herbal medicines, we brought down the inflammation and therefore the inflammatory cytokines, reduced oxidative stress, and brought in a change in lifestyle, which is very crucial for their overall and long-term recovery. And when we talk about yoga, we understand that the parasympathetic dominance was seen, and this could be because of an increased GABA, reduced inflammatory cytokines, increased serotonin, maybe decreased cortisol, and reduced nociception. So that's how we propose and understand the mechanism. Next slide, please. So there are different other methodologies used in Ayurveda, such as Nasya, Shirodhara, Shiroputyu. Next slide, please. Please go on. And then we also have massage therapy, cold packs, acupuncture, with Dr. Geeta will elaborate. And therefore, the key takeaways here should be that you need to really work on relaxing your muscles, reduce your stress, work on yoga, avoid additives, preservatives, and bring in a large lifestyle and dietary modification, and practice certain specific, practices of yoga, such as head rolling, Bhramari pranayama, shoulder and neck strengthening, which might largely help you to keep away frequency and keep away the numbers of migraine attacks. Last slide, please. So therefore, what I would like to conclude with is, though pain from migraine may be inevitable, but suffering from migraine is optional. So therefore, definitely know that yoga and Ayurveda can strengthen an individual and convert the inevitable to optional. Thank you very much, Anjali ji.
of course, the whole message was wonderful, but your last slide gave the beautiful message, which is actually uh, that message what yoga gives, our Indian traditional medicine gives, that pain is an issue which everybody probably face at some point of time, but how do you face it is an optional thing. So whether you want to face it or not, the choice is with you. So the be it the lifestyle choices, be it managing it using multiple other approaches, when such an option is available, it's within our purview that how do we manage it. So thank you very much for initiating this whole discussion for today, bringing Indian wisdom and Indian perspectives, primarily bringing the concepts from Ayurveda and yoga for the understanding as well as management of migraine headache. So, as I mentioned in the beginning, we have with us Dr. Praveen Thomas. Dr. Praveen Thomas is an authority in this field. Dr. Praveen is actually the individual who is leading this whole discussion and dialogue on this particular topic of pain management and migraine headache. Dr. Praveen Thomas is actually attending multiple programs at this point of time. So we are so grateful for Dr. Praveen for his time, for being with us and give this whole perspective of migraine management through various approaches, what otherwise people look at from a modern medical perspective. I'll take a few seconds in introducing Dr. Praveen Thomas, who has an amazing track record of bringing this whole understanding. So just a second, give me a minute because I don't want to miss out anything what Dr. Praveen has done so far. So Dr. Praveen is actually the consultant neurologist and lead of headache medicine at Basildon University Hospital, Mid and South Essex NHS Foundation Trust. He is also the honorary clinical teaching fellow at the Queen Square Institute of Neurology, University College London, and the founder and treasurer of Asia Pacific Headache Society, which has very quickly grown to make itself its name as World Headache Society. So Dr. Praveen Thomas has completed post-graduation in general medicine and chose neurology as super specialty and worked for 2 years in neurology before joining a diplomat of National Board Higher Specialty Training in Neurology from Amrita Institute of Medical Sciences in India. During this time, he won 5 Best Paper Awards in neurology. This is what I was talking about, the amazing contributions and academic rigor with which Dr. Praveen has come up as a professional in this field. So he has also won a national award for Best Paper during his MS. He has passed his postgraduate diploma in clinical neurology from Queen Square and diplomat of the European Board of Neurology, both with a distinction. He also completed a 6-month fellowship in interventional pain management from India and a clinical fellowship in headache from Queen Elizabeth Hospital in Birmingham, UK. He is the founder trustee, as I mentioned earlier, and treasurer of the World Headache Society. He is also a reviewer for American Headache Society's journal Headache, which is the most prominent journal in the field of headache, and chief of the headache section of the journal on recent advances in pain. He is a clinical teaching fellow at Queen Square Institute of Neurology, UK, and he continues to teach and publish in general neurology and headache medicine. If I want to talk about his achievements and mention about his affiliations, awards, etc., probably it takes another 15 to 20 minutes for me, because he has so much of credentials backing his professional career. So, without taking much time, it's my privilege inviting and introducing Dr. Praveen Thomas to all of you to know the right perspectives of headache, right from its understanding, etiology, and management, bringing it from the conventional medicine perspective. Over to Dr. Praveen Thomas.
Dr. Manjunath, I must thank you so much for inviting me to this gathering. Let me just tell you that from the perspective of evolution, if we look at how organisms have evolved from prokaryotes to eukaryotes and then the human beings, the question is basically why life, why evolution? That's a mystery there. But if you look at how eukaryotes have evolved over the years and why headache and why all this, one of the important things which I have sort of understood is that it's got to do a lot with the evolution of the brain. So you have more evolution, you have more complex diseases. So as far as humans are concerned, we have the hypothalamus, which tries to bring a rhythm, a baseline rhythm. So if you look at all the Eastern, traditional systems like yoga or Tai Chi, or take all the Eastern systems together, they've all been focused on developing a rhythm as far as the systems are concerned. So we come to 2 points, basically two diversions. One set of genes, genetics, which are acquired by a series of evolution, which makes you as an Advaiti, or you could call us a holist, which says that they're all the same. Right? There's no Advaita, there's just oneness. Everything is one. Versus, you could bring across another group of people who are called as Dvaitis. So everything is separate. Right? So you have migraine, you have this sort of disorder, you have this personality versus this personality. So everything is separate. Categorization and classifications. These are all the different types of ways in which the Dvaiti wants to be what is called as a splitter. A splitter, and the Advaiti in the philosophy, if you look at the ancient philosophies, not just that of the India, but in most of the philosophies, be it Greek or be it Chinese, you could find that there's two different groups. One is that everyone who understands everything to be as a sort of interconnected. I mean, there's just one substance theory, that's the Dvaiti, versus there are 2 or 3 different groups, that's the Dvaiti. Now, the most important thing what I want to emphasize is as far as migraines and headaches are concerned, there are 2 questions. Why did headaches ever come across? There are so many theories. There's so many things. Let's not get into that. It's not a theoretical discourse. That's about how we can manage those things. Now, time immemorial, all civilizations throughout the world, from different parts of the world, have their own systems of managing these disorders. They've tried all sort of strategies, right from poking the brain, kind of drilling and taking herbal treatments. Now, when it comes to the subcontinent, that's basically the subcontinent. I mean, I can't say it's India, it's subcontinent. So you can have Bangladesh and Pakistan, Sri Lanka. They're all subcontinent. Historically, they have developed a system which is sort of having elements which accommodate everything, Dvaita, Advaita, everything, where you have the Vedas and you have the Atharva Veda, and then you have the Upaveda. My understanding is that Ayurveda is an Upaveda of Ayurveda. So they had a system of medicine. They had unadulterated herbs in nature. They use that and they get relief. Now, with the Industrial Revolution, what has happened is that people could now open up bodies and see things in detail, microscope, look at structures like hypothalamus, thalamus, or whatever, and then finally formulate that this is this practice coming across, and this is dissecting, and this is going from this point to another point. But it all boils down to the same thing. The customer, the client, the patient who's in front of you is someone who is suffering from headaches. No matter whether you select it down to fibers and networks and proteomics and genomics, or whether you talk about vata, pitta, kapha, it doesn't really matter. At the end of the day, what matters is, are you able to bring about a good quality of life for that individual? Every single individual is not just alike. I mean, there are people who are destined to become leaders in industry, in science, Nobel laureates, and pro vice chancellors, just ordinary people like myself. So everyone's got a different set of genetics and epigenetics. It's just quiet. We know that there's a lot of genetics. The question is, can someone grow beyond their genetics and epigenetics, and to make sure that you have an answer to this problem, which is really troubling, because if you have a headache, it's not just about the headache, but the cognitive and the behavioral issues which come about it, and therefore you're not able to function, you can't study well, you can't join certain systems of medicine, and you can't become productive citizens of society, and therefore you're being disabled. So now the question really is, how exactly can the Dvaiti, that's the dualist, and the Advaiti, which is the holist, join hands together? You can have umpteen debates from all systems of medicine regarding questions like idealism, materialism, philosophies which have tormented mankind from the beginning. What exactly is the meaning? So what you have acquired gives you an important affinity towards one system or the other. By default, you could be Advaiti or not Advaiti. Or you could be someone who is between them. You could be someone who believes in neither of these. You can believe in multiple different. The whole point is not to thrust down your throat in what I believe or what Dr. Manjunath believes or Dr. Vasudha Sharma believes. Ultimately, it's about coming to terms with your own belief systems. And the most important thing, as far as you are concerned, is that all of these are true. That's the best part of it. All of these are true, right? So as far as a disorder like headache is concerned, what it requires is that you must have a lot of Dvaiti or a dualist or a splitter approach in understanding the whole or the holistic approach. So I'm not saying that one is superior to the other. If I was an Advaiti, I would say that, come on, please, Advaita, this is the ultimate. You guys are nonsense. And the Dvaiti will say that, come on, we guys are the smartest. You guys are just crazy. So it's not just basically thrusting down one over the other. It's about assimilating both. So which means that in the current situation, how science and arts and every systems are Dvaita or dualism has overtaken holism and Advaita. Let's face it. Advaitis you can find them in certain ashrams and you can find them in some caves. Majority of the world's population identify this as different from you. The cave is different from you. Everything is separate. There's a duality and there's a multi-parity. So with the current circumstances, the way out is this. This is my personal take on it. Understand that both of these approaches are important. Understand that cultural perspectives and epigenetics is important. So you have genetics. So if you're born with a set of genes in Austria or whether in India or whether Canada, your genetics will kind of unfold. And then you have the environmental circumstances which kind of mold that particular individual. So whatever that is, the most important thing is to understand that as far as disorders such as the commonest disorder, why headaches and why migraines concerned, it's all to do with, if you look at the point of splitter point of view, it's got to do with the system of sensory integration. So you have sensory integration from all the five visions, the eyes, the nose, the ears, the taste, sensations, they all being assimilated. Then you have multimodal integration in the brain. So if there's a flux in that, you get a headache. So evolutionally, what I understand is that anyone who has got a flux in this headache, in the baseline, gets a headache, which basically means that you're not destined for that. The destiny of every individual is to reach that stage where the fluxes are smooth. The fluxes are not wild. Like, for example, you have a hypomania, you have depression, you have hunger, and you have satiety, and you have anger, and you have being very kind. You have excitement and being top in the world versus depression. This flux is what basically triggers the thing called migraine. And there's an organ in the brain which looks at all the system, the hypothalamus and the thalamus, and a lot of circuits. My point is, those of you who are listening to me, if there was one single point of reaching that stage when the extreme fluxes become minimized, that minimum flux, that minimum rhythm of the universe, the minimum rhythm of what life is supposed to be, that life which DNA is supposed to evolve into, and that's the basic rhythm of the universe, then there wouldn't be these sort of disorders. But everyone is not alike. Not everyone reaches this level. So the process to reach that level is to do with lifestyle changes, including the traditional systems which are supposed to bring a balance in Vata Pitta Kapha, in trying to understand that every individual is different, and therefore there has to be a guru. There has to be a system which is tailor-made for an individual and which enables that individual to balance his energies and his unknown energies and his system and his genetics and epigenetics, such that that individual is able to reach that level of balance. Dr. Manjula Sharma, do you have any specific questions for me?
Well, actually, you have brought in a wonderful point for discussion, while probably everyone was expecting that you will get into the brain and you will uh, bring out that underlying mechanism of migraine. But you brought in uh, wonderful theories of Dvaita and Advaita, and then took it to the understanding of neuroscience part of particularly migraine. So I just wanted to check if Dr. Geeta is available, because there are many questions pouring in to Dr. Praveen as well as to others. So just quickly, I want to finish Dr. Geeta's presentation, and then I wanted to open this whole forum for discussion. Uh, do we have Dr. Geeta Shetty? Right? Yeah, she is there. So let me take this privilege of introducing Dr. Geeta, uh, who will be talking to us about yet another important aspect related to migraine, bringing in the pain.
Sorry to interrupt. I need to request Dr. Geeta to switch on her mic and, if possible, video, just to inform our viewers and Dr. Manjunath. Dr. Geeta is facing a bit of a technical problem and some internet problem at her end, but we are hoping that Dr. Geeta will be able to contribute to this webinar. Dr. Geeta, we request you to please switch on your microphone. I think she's still having a bit of a problem. I'm going to join her again. Yes. Dr. Geeta, can you please switch on your microphone, please?
Yes. Thank you, Dr. Geeta. Dr. Geeta,
Hello.
it's fine. Yeah, we can hear you very well. Thank you very much for joining. And don't worry about the video. Maybe if there is any issue with the video, what we will do is we are going to use your slides, and you can just give your talk and tell us when you want us to change the slides. Before that, let's give me just a very few minutes to introduce Dr. Geeta Balakrishna Shetty. Dr. Geeta Balakrishna Shetty, she is the professor and dean at the Division of Physical Therapeutics and Nutrition at SDM College of Naturopathy and Yogic Sciences in Ujjire, which is in southern part of Karnataka in India. So she has completed a bachelor's in naturopathy and yogic sciences, very first batch of naturopathy graduates in 1994, an MD in naturopathy, clinical naturopathy from the same college, and she is also pursuing a PhD from my SDM college through the Rajiv Gandhi University of Health Sciences at present. So as I mentioned, she has lots of credentials when you talk about naturopathic medicine and acupuncture in particular. She has little more than 26 years of teaching experience for both UG and PG. She is the most loved teacher at STM College of Naturopathy and Yogic Sciences. She has also worked as a medical officer at the well-known naturopathy hospital in Dharmasala. She has guided several MD students for their research work in various aspects of yoga and naturopathy. She has also worked on various research projects as an investigator. Some of them, very few of them to mention, are one on hypothyroidism, another on PCOD, and of course, several others, including obesity, cardiovascular disorders, etc. She has little more than 15 publications into various areas, but many of them are related to pain management and acupuncture, and she is the most appropriate person for today's discussion on migraine headache management through acupuncture. So it's my privilege introducing Dr. Geeta Shetty, who will be talking to us about the concepts of acupuncture, its relevance, and its application in the management of migraine headache. Dr. Geeta Shetty, please. Do we have Dr. Geeta here? Looks like there is some issue with. Yeah, she is back here. Yeah, Dr. Geeta.
Hello.
Yeah, yeah, we can hear you. Please go on. Dr. Geeta, yes, you can unmute and you can go on. We can hear you.
I okay. Am I audible?
Yeah, very clearly.
Am I audible?
Yeah, we can hear
Yeah.
you.
Okay. So I'm just going to share my experience and opinion regarding the acupuncture and its management through, the role of acupuncture in the management of migraine. So, acupuncture is an art of healing which is used in traditional Chinese medicine. In spite of the WHO recommendation for about 43 diseases, the use of acupuncture is uh, less in use because of the lack of understanding regarding the mechanism of acupuncture. Here, I just want to explain regarding the basis of acupuncture, how it works. So, there are body, the concept of TCM is there is an energy concept and the meridian concept. The energy, actually there are divided into two aspects, which is compared to right and left half of the body, which regulates the autonomic, which is and can be compared with the autonomic regulation. So the balance of the positive and negative energy is the main aim of acupuncture. So in health or in there is an imbalance of this yin and yang, that is the energy, which is responsible for all the functions, regulation of our neural system. So the main aim of acupuncture to allow the flow of energy in a uniform pattern and maintain the health. So there are some corresponding, because of this TCM, the acupuncture is evolved since 2000. It was in practice around 2000 years back, where there was no scientific explanation. This was only initially based on the philosophical concept. Man was living in the environment, and the external forces, that is cosmetic as well as the environmental energies, are responsible for health and disease. So here are few elements which are representing the character of internal organs, like the fire, which is representing the heart and small intestine, and then earth, which is representing the stomach and spleen, and the metal, which is representing the lung and large intestine, and the water, which represents kidney, urinary bladder, and the wood is represented by liver and gallbladder. To understand this, these elements are seen in the internal organs in their character. So they balance, otherwise, each these five elements represent the internal systems. In physiology, they explain that the regulation, homeostasis between these five elements is, five system or the different systems of the body is nothing but health. Similarly, in acupuncture, they say balance between these five elements can be an example, or they can reflected in the internal organs. If any disturbance in these five elements, representing the disturbance of the imbalance or disease. The understanding of migraine. So according to the TCM concept, unlike the other factors, there are two important factors, that is external and internal factors, which we otherwise explain endogenous and exogenous factors. So exogenous factors are totally like environmental factors. One may be the wind, which is according to the season, it may be cold or heat. And the internal factors, TCM explains that the liver, kidney, and spleen mainly regulates the organs, especially like the brain functions are supported by the regulated function of liver, kidney, and spleen. According to the modern physiology, it explains that this regulation in the brain function is the main cause for migraine. So the factors like how liver is responsible. Emotional disturbances mainly brings disturbance in the chi level, especially of the liver chi. So this liver chi, whenever there is a liver chi disturbance, liver function is disturbed. So that is mainly due to the uh, insufficient support of another element, that is water element. So whenever the water is not supplying the wood element properly, because there should be a coordination between these five elements representing internal organs. So when this fails, there will be a water fails to nourish wood. That is a common concept. There is a excess of this wood element which is damaging the brain functions. Similarly, the congenital factors. There may be a congenital chi deficiency which results in the dysregulation of brain function. So there are some studies which are associated with this is the migraineurs are chronic migraineurs are prone to develop chronic kidney diseases. So next about the spleen and the stomach relation to migraine. So improper food, especially in the form of diet, damages the spleen and stomach. So maybe it is the enteric explains about the brain gut dysregulation. So whenever there is a improper nourishment of these stomach and spleen, it hampers the nourishment of the brain and it results in dysregulation of brain functions. So there are eight factors under which the cause of migraine is explained. So one is maybe external or internal, otherwise it is excess or deficiency, yin or yang, cold or heat. These are the eight factors, and also the endogenous factor like cold, heat, and dampness are responsible for causing the disease. And in TCM, in acupuncture, we need to identify by the proper diagnostic methods, that is by observation of the body and then the tongue and the pulse and their behavior and the likings, emotional factors, all these contribute for the diagnosis. So main manifestations are like there may be excess of wind, that is an external environmental factor which is affecting the peripheral part of the body to the external part of the body, which is gradually affecting the vascular system or the nervous system. So here the headache, wind, cold, there are differentiating factor like headache is on, off, or radiating to the nape of neck. If it is to the excess of heat, there may be the character of headache is defined as distending pain, especially in the head region. There may be aversion of wind. So headache also may be due to acute onset in case of damp cold. So associated manifestations in different conditions are different. Based on that, we can diagnose. Like in wind cold, there may be absence of thirst, aversion to wind, or again associated with fever. Or sometimes it is also in case of wind heat, the face, because the heat which is seen in summer season, so the face may be reflecting red in color, and the person may be desire to drink cold water, and also there may be, as we discuss in other thing, yellowish or concentrated urine. In same way, the pulse also changes. So based on this, there will be syndrome analysis which can help us to identify which pathogenic factor. Again, the factors responsible are the liver, kidney, and there may be another internal factor, phlegm, otherwise called as mucus. So these are the associated manifestations. We can see if there is a liver disturbance, we can especially see in the costal and hypochondric region pain associated with the headache. Whereas if it's due to kidney deficiency, we can see especially in the dizziness, soreness, or sometimes weakness. And if it is phlegm, again nausea and omitting of mucus or phlegm. That is the TCM concept, where we can also differentiate the different uh, pathogenic factors, and based on that we can prescribe the points also. The concept of management according to TCM is specially to disperse or to expel the external causes. It may be like clearance of collaterals or stopping of the pain. As it is the acupuncture, the energy is supplied through the meridians, especially through the meridians. So there is a blockage of meridians due to external or internal factors. So we have to clear the blockage by selecting the proper acupuncture points. So here, when there are important points used, especially like acupuncture points, which is external factors, wind, cold wind, heat, or wind dampness, two important points are used, especially over the neck region, nape of the neck, which is from the gallbladder meridian, and also one point at the junction of the eyebrow and the lateral canthus of the eye. So these points helps in expelling the wind, dispersing the cold, as well as clearing the heat and dampness. And the internal disorders, like in case of liver yang, certain points are prescribed. It may be like gallbladder 5. These are from the different research evidences. GB4 commonly used points, liver meridian point, and from the kidney meridian points, and we use points from governing vessel meridian. So there is one more factor. The headache is also diagnosed according to the meridian. So there are 6 meridians supplying to the head region. They are stomach meridian and the associated large intestine meridian, which represents the forehead. And there is a gallbladder and another meridian, that is triple meridian, associated with the lateral aspect of the head, and the back of the head, urinary bladder meridian, and the small intestine meridian. And the top of the head, the vertex region, is supplied by the liver and the other supporting pericardium meridian. So whenever there is headache which is localized to this region, these meridians are identified as blocked meridian. The concept is to, by stimulating the needles or by using the different modalities in acupuncture like moxibustion, ear acupuncture, we can stimulate or regulate the flow of energy in these meridians. So clinical uses of gallbladder meridian, which helps in regulation of circulation and also clear with the heat and also to stop the wind. Kidney meridian points and liver meridian points are used as yuan source points, which means there is a pool of energy. By stimulating these points, it can be regulated through the meridians. And pericardium meridian, which is clears the restlessness, which helps to calm down the mind. And also stomach 44 is actually corresponding to the flushed face. So in case of in other internal disorders like kidney deficiency, the specific points are from the kidney meridian. And then the importance is to reinforce the kidney energy. So there is a deficiency of kidney energy, so it is to helping to reinforce the kidney energy. And gallbladder and extra, other than the regulated meridian, help to regulate the local meridian. So, in case of phlegm associated headache, it may be associated with sinusitis or some respiratory, upper respiratory infection also. So, here the points are used from the stomach meridian and also from the meridian. CV meridian refers to the meridian which runs along the anterior midline. So, stomach meridian and spleen meridian will help to resolve the phlegm, that is the sputum, and the CV meridian helps to uh, clear the phlegm from the associated collateral meridians. Now, coming to the research evidences, there are around 592 articles are supporting the use of acupuncture effectively. So among them, they because of effective reduction in the duration and frequency of migraine, and also it is proved it is safe, effective, and accessible alternate therapy. As I told, the evidences are explaining the regulation of chi with the acupuncture. So mainly puncturing the needle through the different pathway, it helps in central regulation of the autonomic nervous system as well as by regulating the through the central nervous system. So there is one more study showing that the spectroscopy, MR spectroscopy of brain, there is metabolic response and recovery of the neuronal mitochondrial function of the pain pathway. So it is also shown that there is increased N-acetyl aspartate, which is responsible for mitochondrial energy regulation in the nerves. So, in acupuncture, in migraine, it is studied that NAA concentration is reduced, and after the acupuncture, there is increased NAA concentration. So, and also acupuncture helps to stimulate the larger afferent fibers and inhibit the pain transmission in the central nervous system. And also, it helps to release the pain suppressors like opiate substances, endorphin, serotonin, dopamine, and also neurotropins in the central nervous system. So there is also evidence that it helps in reducing the matrix metalloproteinases, which is a inflammatory, also an inflammatory marker. So it is said that as Sir Praveen sir explained, there are different concepts or theories. So one may be the inflammation is the cause for headache, so there may be reduction of these during the process of acupuncture. And there is also regulation of the descending pain pathway and also peripheral excitatory neurotransmitters, thereby it helps to reduce the pain. So, and also since there is a dysregulation of cerebrovascular blood flow, that is the main cause for, maybe one of the mechanism for the pain. So the acupuncture showed that there is improved cerebrovascular regulation, and also repetitive somatosensory stimulation which happens in acupuncture helps for regulation of the abnormal cerebrovascular response in migraine patients. So, and also important part of it is neuronal plasticity. So acupuncture benefit or the recovery from the chronic pain, that is evidenced by the presence of, hello. Am I audible?
The
Am I
research,
audible?
yeah, we can hear you. I was just mentioning that the research component, whatever you have added, is wonderful. And since we have overshot our time, and there were lots of questions which were coming up, we cannot end any of these discussion forums without taking at least one or two questions. So I think reserving some of these data points which you have mentioned with respect to using acupuncture as an evidence-based science, let me open it up for very quick, very few questions because we have already crossed 8 o'clock. And one important question what has come up at this point of time. Do we have Dr. Praveen here, Dr. Anjali?
No, I think Dr. Praveen had to leave because he had some other engagement. So
Yeah,
unfortunately, he
perfect.
had to leave. He was juggling between two programs.
I
So
know, I know, I know.
anyways, he overshot the time, so he had to leave, unfortunately.
There were a few
But
questions, Dr.
questions,
Praveen, which
yeah, the questions posed to Dr. Praveen, we will be posting in our website. So we'll be connecting with Dr.
we
Praveen
will
at a
take.
later time and getting the answers to those questions.
There were two questions asked to Dr. Praveen. One is correlation with between migraine and COVID. Whether people suffering from migraine are they more susceptible for getting COVID infection? And second question, because he started talking about Advaita and Advaita, so there's another question related to spiritual neurophilosophy related to migraine headache, which will be answered, as Dr. Anjali mentioned, through the website. Another question is to Dr. Vasudha. You spoke about Prakriti and Gunas on one side. You also brought out research evidence to suggest. Uh, what is your experience? Whether any particular Prakriti people are more prone for migraine headache, number one. And number two, are there any specific Gunas contribute as factors affecting or influencing migraine headache? You have to unmute, Dr. Vasudha.
Yeah, I think that's an interesting question. So, who is more prone to migraine? See, I can only validate it based on some research we have done in understanding which Prakriti people can be prone to migraine. So, as per this, which was also published in the the journal Cephalalgia as an abstract, so we have understood that Pitta individuals, mostly the Vata Pitta individuals, are those who are prone to migraine, but that's a very small data, so we might need larger studies with larger numbers to validate the same. But otherwise also, as per the principles of Ayurveda, a Pitta Prakriti individual may be more prone to that. But otherwise, a person who has this basic stressor in him, or the person who can really get stressed very easily, who has a very sensitive brain gut index, can become very prone. And when we
Any,
try to
do you
understand
want to?
and the triguna aspect, so there once again a person who has more of rajasika guna is definitely prone to migraine headache.
Yeah, I mean, it's very interesting. There is another publication of yours which says that lifestyle is a common denominator for both causation as well as management of migraine headache. I know it's a very wide topic to discuss. Any one important factor you would like to stress on when as we move to the closure?
Yeah. So the one main important factor I would like to stress upon is diet, because diet plays such a crucial role in everyone's life that we cannot live with food, right? And we need to also stay healthy. So both are important. So what do we eat and what is right, when it comes to food, which cannot trigger a headache? That's very crucial with migraine patients. So say food such as something which is spicy, which is fried, which may be oily, and other specific takeaways which people should understand as processed food, maybe cheese, and then in India they use a lot of paneer. So these can also be triggers. So milk and milk products are not greatly indicated, but buttermilk is greatly indicated when it comes to the understanding through Ayurveda, because buttermilk is a pittahara which can also desensitize your gut and therefore help you have less instances of headache.
Yeah, wonderful.
Um,
Uh,
so
There's
if
only
you
one
don't mind,
question which we are not taking up, which was something to do with Marma Chikitsa, which was asked to Dr. Geeta. This will be answered through the website because this is something very interesting, which is spoken very strongly in Siddha medicine as well as in Ayurveda. I think the relationship is worth an explanation as we move forward. Dear friends, it's a wonderful occasion for all of us to understand the basics of migraine headache and then to understand the management strategies, including modern medicine, Ayurveda, naturopathy, with a special emphasis to acupuncture. It was my privilege spending time with such great luminaries who have worked in the field of Ayurveda, yoga, and acupuncture and modern medicine. And I have to be really thankful to AAYM, which actually brings yoga and meditation. Of course, we bring meditation along with yoga, and which also is making an attempt bringing a series of webinars on evidence-based approach into yoga and meditation. Special thanks to Dr. Indranil Basure. Without this mention, I will not be doing any justice, because he is the person who brought this whole idea under this umbrella of the American Academy. And Dr. Anjali, who has been an amazing coordinator. She is a yet another person rich of knowledge, but she won't prefer talking, but we should listen to her sometime as well. And to the whole team, particularly Gaurav, for making all of us work together very well. So thank you very much, Dr. Anjali, giving us an opportunity to share these views. And I'm sure we will be getting connected with the audience and students and experts subsequently with other webinars. Over to Dr. Anjali.
Thank you, Dr. Manjunath, Dr. Vasudha, Dr. Geeta, and Dr. Praveen. In fact, we had a lot more questions, and I was wondering if we should take it on, but of course, we have grossly run over time. Question related to pregnancy and migraine. This was very relevant question, and because people are restricted with the allopathic medicine application during pregnancy. So these are some pertinent questions that we had through our WhatsApp and through our email from our viewers. But this is a promise to our viewers that Dr. Vasudha, Dr. Geeta, and Dr. Praveen will be answering your questions offline, and we'll probably post in the chat here and also on our website and Facebook. So please remain connected to us. I'd like to thank all the speakers here. Thank you very much. And we hope to see you again in this show. Shubh Ratri. Thank you.